Hello, friends. Welcome to your weekly motivational moments with Eric Vickery, president of coaching at All Star Dental Academy. And with me is my friend and fellow hygiene coach, Lynn. Hi, Lynn.
Hi there.
All right. We're doing back to back weeks here. We just talked about just what is a hygiene driven practice overall. And now this is the how to. So, what steps can we take in creating this hygiene driven practice that you're so passionate about? What
Yeah.
would you say?
Yeah. So if you remember last week, we shared the what makes a hygiene driven practice. Now, and the first thing we mentioned is vision. You want to
Mm,
be driven by your vision and articulated with your team, especially articulated with your hygiene team, as that and their part in that vision that they can go behind that vision and make it happen. And then you have to make sure you inform everybody so you're doing the same thing, calibrate with everybody as far as
mm.
your
Oh,
standard of
yeah.
care. You want to establish your standard of care and your treatment philosophy. It's so sad when you have somebody who when your dentist says that you're ready for hygiene, but the hygienist says, no, you don't need to, patient go like, well,
Oh,
calibration,
yeah.
you're not
Yeah,
talking the
I
same.
think we could probably spend an hour of just being on the same page, not only philosophically, but just clinically on even probing and measuring the health of the gums, right?
You bet,
There's
you
so much there.
bet.
And then what does a treatment plan look like? And how do you present that? And are we watching things or all of that? So
You bet.
that's a long topic to get
No,
into, but that's
exactly. This
definitely a meeting to get clear
Yeah,
on. Yeah.
for another session because it creates credibility for your practice.
Mm,
Okay, so the
that's
next
right.
thing
That's right.
the next thing you want to do is empower your hygienists. You see, your hygienists are
Mm,
trained to do certain procedures, and you want them to be able to do that, especially if your state allows it, like anesthetics, whitening, all those other procedures, are adjunct procedures that help
mhm.
with your production. And another thing I think is very important is to empower your hygienist to address your patient's concern. And that way, before you come in, your hygienist already addressed that and your patient is ready to positively accept your case presentation. That is a big assistance for your hygiene team. I think with that, your case acceptance should skyrocket. And I know
Mhm.
some dentists who would love to have their hygienist be part of that. So that's empowering them.
Yeah,
And then,
I would
yeah,
just add to that. I've had some clients where I find out that sometimes the hygienist isn't saying anything when the doctor comes in for the exam. Sometimes the
I
hygienist isn't even
know.
in the room. They've moved on to another room.
Yeah.
And
Hmm.
so I think this is a real powerful point in that, hey, your hygienist has built rapport. She's done diagnosis. She's already talked to the patient about it. And when the doctor comes in, it can just simply be a confirmation that doctor's in full support of what the hygienist is
I
recommending, right?
I know, and it's like opening the door for you to say, yeah, like, okay, I'm here. I just that confirmed the diagnosis. Let's go. I mean, that is a big help for the doctor. I think that's
Yeah,
a big thing that the hygiene team can help the doctor with. So
it's good.
aside from that, you want to execute systems. Okay, these systems, having
Mhm.
that again, it creates a standard and guide that provides consistency between providers is so important, right? So we're just talking about calibration, right? So having a consistent standard of care um, will provide that for you. And again, your patient will like give you credibility between the hygienist and the doctor.
Yeah,
Okay, yeah. So,
and we could see this in our KPIs even
oh,
with
yes,
looking at different hygienists, and one hygienist has got perio percentage here, and one hygienist,
I know.
30%, 40%, and the other hygienist might have 10 or 15%. Now, there could be reasons for that. Typically
Right.
the
What are they doing
longer
differently?
standing
Yeah,
hygienists might have lower. Yeah, but they got
correct.
to be on the same page clinically. Yeah, agreed.
Yeah.
Okay, cool.
Okay.
What
So
else?
we're talking about systems, right? Guess what? The primary
Yeah.
systems we have to employ in order to have rapport and engage with our patient is the great call. It starts with a
Mm,
great call. I think with a great call, you get a leg up on your relationship with your patient. So if, for those who have not
mm,
dove into the great call process,
yeah.
that is an awesome system to have in your practice. And the
These are
next
some good
thing,
points. I love it.
yeah.
Love it.
So next thing you want to have are diagnostic tools. What are the diagnostic tools you're using? I know some offices do sell Veritest. They'll go for oral cancer screening. Anyway, you want to calibrate with each other that you're using it regularly, or whatever your criteria is for using their diagnostic tools. Now, and then you want to create
All
systems.
right.
Okay, here's important. You want to create systems that address your standard of care and your treatment philosophy. That way, everything is addressed. Nothing falls off the cart. Because when doing
And
that,
that's going to take, yeah, you got to
mhm,
communicate as a team. You're going to take team meeting time. You're going to need to
correct,
collaborate. You're going to make sure you execute and you talk about if
correct.
it's working or not. And if you're not doing that, something's probably missing. Is that fair?
Exactly, exactly. Because you want to be saying the same things, doing same things, so that the patient will go see one hygienist and they go like,
Yeah.
okay, well, she didn't do this with me last time, or she said something different last time. So, what does that say about your practice?
All
Okay.
right. Well,
So
listen, this has been really good. There's so much more to be said here. There's so many. I know you want so much more. If you guys want more of this, reach out to Heather at allstardentalacademy.com. Ask about hygiene coaching with Lynn. She's got a phenomenal, systematic, manual approach to growing your hygiene department. Thank you, Lynn, for joining us. I really appreciate
it's
it.
my pleasure, Eric. Thank you.